So this is Dr. Jen, and I'm here with Karim, our wonderful coach for FAB. And Karim, thank you so much for joining us today. It is honestly always a pleasure when I'm in the space with you, Karim, always.
Thank you so much. I'm always happy to learn more about FAB.
Hmm. So today we're going to do something a little different. So this is called Eat Your Damn Food. And usually I'm the one that's asking a lot of the questions, but today we're going to do it a little different. And Kareem, you're going to ask me more of the questions about eating disorders, getting help. What about if you're concerned about a loved one who maybe you suspect might have an eating disorder and you're not sure how to approach them? So where would you like to start, Kareem?
Yeah, so I would start saying that there is so many things I didn't know before I started to learn about FAB. And one of the first one is because we live in a world where physical appearance is so important. And I don't know if there is a path to discern if I have an eating disorder versus if I'm very concerned about my health, if like what I'm doing is in my best interest. So how do I know
Yeah.
the difference between one and the
Yeah.
other?
So, I like to think of these things on a spectrum, right? Because living in these bodies, having to deal with our relationship with food, those two things never stop if you're a human being, right?
Mhm.
So I think at one point in my career, I used to think of it only as categories, but now I think of things more as a spectrum. But your question is such a good one. Like, how do I know if I'm kind of on that part of the spectrum where I'm really dealing with a problem here? Like I'm dealing more with disordered eating or an actual full-blown eating disorder. The biggest thing is how it affects your functioning. And some people, though, may be like, it's not affecting my functioning so much. And like, what do I mean by that? Because that sounds a little clinical, like a little clinical, like it's affecting my functioning. So here would be an example. Somebody I spoke with over this last week, and she was trying to figure out the same question. And she said, well, I know I'm having a really hard time when my friends invite me to go out to a restaurant now. And in the past, that never was an issue for me. I used to like, hey, they want to go to this, place or this cafe. And now when they ask me, I start getting really anxious. I start looking at the menu, the place they want to go to. I start looking at the calories. And half of the time, I don't even want to go and I cancel. So I'm starting to see it's not only affecting like my meals, it's starting to affect my social connections with others. And she also went on to say it's like, and she kind of looked very flat when I met with her, like her expression, she looked kind of like a little numbed out, a little sad. And she said, yeah, like since struggling with my relationship with food, I'm noticing I'm not eating as consistently. And I'm really finding like my motivation is low, like my mood is low, like I don't have the energy to do the things that I want to do. I'm just noticing I'm not as happy as I used to be. That's another thing to start paying attention to. It's like, because these eating issues don't usually happen in a vacuum, right? It's like they start affecting everything. Just like I'm sharing with this young woman, like it affects us socially, it affects us in terms of like sometimes our bodies, our energy level, our mood. So it starts impacting all the different areas of our life and not in a positive way.
Hmm. So there is a couple of things that you mentioned that I would see myself doing, especially there was a time in my life where I was vegetarian and I was pretty concerned. Oh, we're gonna have social time, like, yeah, and I would go like a few of the things that you say, I did or
Hmm.
I have done. Now, my question is, when or how can someone be diagnosed? Because I guess that's a difference between like me not being sure.
Hmm.
Um, when it's time to, is there a diagnosis for that? Like, how do I know? How do I confirm if it's in fact an eating disorder? or it's just me that I'm, very self-conscious of everything that I eat.
Yeah, well, look, if you're even asking, if somebody's listening and has that question, what I would say is like, don't wait to see. Because if you're even asking this question, like, is this a problem for me? There may be a good chance, like, either it is an eating disorder or you're starting to move in that direction. And what I always say to people, and I say this to families a lot, if you can be more proactive, right? If you can catch the problem before it's a full-blown problem, it's going to be easier to get treatment and to start turning things around, right? So if you're even asking that question, what I would say is you want to find a specialist who can actually find out, go through specific questions to help you see, like, am I in that disordered eating category? Am I actually, I'm fitting the criteria for an actual eating disorder? Am I starting to head that way? Are there some things I can do to turn this around? So what I would say is, like, don't wait, right? Like, obviously we're specialists. We can do an assessment with you. There are some medical doctors who do know eating disorders who can also do an assessment. I always offer a resource from the National Eating Disorder Association. They have lots of information. They go through specific criteria, but then they also have a database where you can find a specialist in your area so you can see, like, am I actually meeting criteria for an eating disorder? But even if you're not and you're starting to worry, what I would say, that's the perfect time to start getting help if you have that question about yourself or somebody you love.
Mm-hmm. You mentioned something that also makes me very curious. So if I go to a regular doctor, he might not know what
Mhm.
questions to ask. How, yeah,
Mhm.
because it's easier, I guess, and less confronting to go to my regular doctor. And then maybe if I go to him, like, how do, yeah, because what I hear it when what you said is they might not even ask for those questions, I guess.
They might not ask for those questions, right? We
Mhm.
are working with somebody right now who's in med school, and they're not getting any training whatsoever in anything nutrition related. So look, some medical doctors don't have experience with an eating disorder. And I've had some people come to me telling me certain things their medical doctor has said to them, and it was very triggering. And it was very clear that they didn't have training in this area of eating disorders because it's a specialized area. You may not get this at all in med school or in your rotation or in your training. So I always tell people, like, find somebody who has training in this. I mean, I've worked with a lot of amazing doctors who have gotten this training, and sort of more because they had more people coming to their offices and they're like, whoa, I better learn more about this. So we do work with some incredible doctors. So, like, if that's something you're looking for, it's also like we can help you find that resource in your area, whether it was with us or somebody in your community. But I will tell you, no, not every medical doctor has this training. So that could even be something you ask your medical doctor. Do you have any specialty in this, in working with people with eating disorders? And if they say no, I would find somebody who specializes. It's like, well, if I had an issue with my heart, I'm not going to somebody who doesn't work with the heart, right? It's like you want to go to those people, like, save yourself time, find the specialist for this.
Wow. Okay. And once I go to the doctor, let's say I go, they don't know, like, how can I guide them? Let's say if they tell me, no, you're okay, you're fine. Is there something else that I could do?
Yeah. So first of all, I would say trust yourself, right? Like, if you're feeling like, hey, like, yourself. And if now it's like you were saying, well, how do I know if I'm just being healthy versus, like, now this is a problem? Like, is this bringing you joy? right? Like with what you're doing. Sometimes people will say, well, at first it did, like, oh, this is the typical thing I hear. I started a diet, I started losing some weight, and then I got all these comments and people were saying how good I looked. I'm telling you, that is like a typical one. But then it kind of kept going. And then I noticed like my behaviors, like I was then all over the place with my food and maybe under eating, overeating, a combination. And now I'm feeling so confused about food and I'm not feeling happy and I'm not feeling good. So, like, I think there's something about being really honest with yourself. And if your doctor is like, you're fine, like, I have had a medical doctor say to one of my clients, like, well, you don't look like you have an eating disorder. And it's like eating disorders come in all shapes and sizes. So many people with eating disorders are not underweight or even overweight. They're kind of like right in the middle,
Mm-hmm.
right? So it's easy to miss these things. So if you feel like your medical doctor maybe minimized what was going on, again, what I would say is find a therapist who knows eating disorders. You can find that Psychology Today is a great one, or the National Eating Disorder Association. And there's some awesome nutritionists who specialize in eating disorders, and that would be another way. So what I would say is like really listen to yourself, be honest with yourself, and also know like you deserve the help. Like not like don't wait because these eating issues don't usually get better over time. What I've seen is they progressively get worse. And then when they get worse, it's harder to treat. Like I actually had somebody this morning that I spoke to, and he was so worried, about his loved one who now was in the hospital and had no treatment and now all of a sudden like is in the hospital and was really like beating up on himself like, oh my gosh, why didn't I see this sooner or catch it sooner or, try to do something. And he kept trying to help his loved one, but like they didn't get any professional intervention and now they're working on that. So I just always tell people like, don't wait.
Thank you so much.
Mhm. Thank you,
Very
Kareem. That
useful.
was really fun to be interviewed.
Yes.
Okay.